Let me ask first, have you fully recovered, and what was your experience with COVID?
Yeah, I had a very mild version of it. It was just a day of fever and then 3 days of symptoms. And the only thing that made it a little bit difficult is this sort of fatigue after it for a week or two that makes you less productive than usual. But right now I'm back to normal.
And dialing into conference calls and trying to work on economic policy remotely, never easy. Tom, I'm wondering what the discussion was inside the White House before your departure about a possible contingency plan for resurgence in virus cases and what measures would need to be taken as a result. What did you discuss?
Well, I think there's a couple of aspects of this which I think is important to keep in mind. One is that it's not all about policy in some sense, and I think it's been misguided how much people pay attention to policy here. This is largely driven, I believe, by the American people or the private sector as opposed to the public sector. So if you look at infectious diseases in general, they have this self-limiting feature that is when the disease grows, prevention grows, and therefore the future of the disease is tamped down. And I think kind of that's what we're seeing, what we saw certainly in March and April. The private sector was much quicker than the public sector in terms of the state and local governments in mitigating behavior. So when restaurants were mandated to close, they were about 90 or 80% empty already because the private sector essentially were more dynamic in the response. And what you'll see now is it's obviously an uptick in Texas, Arizona, and California and Florida and other places, not necessarily perfectly correlated with policy, but you will see a response, I predict, to that behavior where the private sector or the public sector, in addition, complementary, will now kind of respond in mitigation towards it. I think, in general, I think it's been overemphasized how much governments can control this as opposed to the American people, which is sort of the driver of this disease.
Well, at the very least, governments will need to respond, right? Because it's all circular. The fewer people go to restaurants and stay at hotels and take airlines, the more those businesses suffer. And if they're important to the U.S. economy, then the government would potentially need to step in and provide more assistance. How do you craft a future relief package when some of this behavior is ad hoc? It varies by states. It varies by counties. How do you do that?
Well, it has to be a lot more targeted, and I think the big issue here is that fiscal policy has to be much better linked to health policy, or what we learned from the disease since March. So what we learned from the disease is actually that young people are very low risk conditional on infection, because we have all these zero prevalence studies that show there's a lot more people infected than we knew we had before. And we also learned that a lot of transmissions is within the households. So therefore, in my opinion, fiscal policy should be much better at segmenting the risk. Because if you look at the economy, that's low-risk individuals that are productive, producing, the vast majority, 95% of the labor market or so is below 65. They're productive and low risk, as opposed to the high risk, which are retired or non-productive. So the key issue, how do you use fiscal policy essentially to subsidize or pay for separation of these risks? That could be, beefing up home care in Medicare a lot more than we have. It could be using hotels, which New York did during its crisis, to house a lot of traced individuals, etc. But I think the key issue which is missed is that fiscal policy should be basically subsidizing risk segmentation from the productive part of the population away from the high-risk, unproductive part of the population. I think that's completely missed in the current discussion.